Dear students, let us discuss about the ischial tuberosity. When you hear the word ischial tuberosity, what bone you should recollect? You should think of the hip bone, which consists of three parts. What are they? The ilium, the fan-shaped one, the ischial, and the pubis. So the three parts of the hip bone are the ilium, ischium, and pubis. In relation with the body of the ischium, you will find the ischial tuberosity. In this picture, you are seeing the articulated hip bone, which is called the bone pelvis. So this is the ilium, this is the ischium, and the pubis of the hip bone. The two pubic bones, they join together at the pubic symphysis. The ilium joins with the sacrum, forming the sacroiliac joint. This is the ischium, and the projecting parts are the ischial tuberosities. The ischial tuberosity is also known as sitting bone because when a person is sitting, the part of the bone that is coming in contact with the sitting surface is the ischial tuberosity. That is why it is called sitting bone. It's also called sidge bone. There is what is known as sidge bath, which is advised to the people who has undergone surgery in the perineal area, so which is an area around the anal opening, and after surgery in this region, especially in the hemorrhoids or piles patients, or in the case of women who has delivered the child, they will advise sitting in a basin with lukewarm water for the irrigation or for cleaning the perineal area. That is called sidge bath, and is the one will be sitting with the ischial tuberosity on any surface. This is called sidge bone also because it is coming in contact with the basin when one is taking sidge bath. It forms the lower boundary of the pelvic outlet, and it is seen as a roughened projection protruding postero-inferiorly from the body of the ischium. And it is covered by gluteus maximus muscle when one is standing, and this is exposed when one is sitting. So it supports the weight of the body while sitting. The ischial tuberosity, it presents three surfaces. One is the gluteal surface, the other is the lateral surface, and the medial surface. What you will be observing is the gluteal surface. This is the gluteal surface, and the ischial tuberosity is the site of origin for certain muscles. Now let us see what are those muscles. They are the gemellus inferior, the quadratus femoris, obturator internus, and hamstring muscles. The gemellus inferior, quadratus femoris, and obturator internus, they are called the lateral rotators of hip. They are the small muscles which produces lateral rotation of hip, and they are called the small lateral rotators of hip, and you have seen them during the dissection of structures under cover of gluteus maximus. The hamstring muscles are the muscles of back of thigh, and they are the long head of biceps femoris, semitendinosus, semimembranosus, and part of adductor magnus muscle. These are the 4 hamstring muscles. The long head of biceps, part of adductor magnus, semitendinosus, and semimembranosus. The ischial tuberosity is the site of arranged attachment for sacrotuberous ligament. So this is the site of attachment for the sacrotuberous ligament. So here you are seeing that ligament. And it also forms the boundary line dividing the perineal area. This is the perineal area into two triangles. A posterior anal triangle which contains the opening of the anal canal, and the anterior urogenital triangle which contains the openings of the urinary and genital systems. So it is having a gluteal surface, lateral surface, and medial surface. This gluteal surface will be showing a medial border and a lateral border. Then the ischial tuberosity is the site of origin for 3 of the small lateral rotators of hip and the 4 of the hamstring muscles. And it is also giving attachment to the sacrotuberous ligament. It forms the boundary between the 2 triangles of the perineum, the anterior urogenital triangle and posterior anal triangle. This picture is schematic diagram of the gluteal surface of the ischial tuberosity for showing the attachments of muscles. The ischial tuberosity, it's a palpable landmark which one can feel 5 centimeters lateral to the midline when the hip joint is flexed. And this gluteal surface of the ischial tuberosity is divided into 2 parts, an upper part and a lower part. The upper part is smooth quadrilateral region and the lower part is rough triangular area. Each of these upper and lower parts are divided by means of another ridge in each into 2 parts. The upper portion, which is quadrilateral and smooth, is divided by an oblique ridge that is running downwards and laterally into an upper part that is lateral and a lower part that is medial. So there is an upper lateral part and lower medial part in the upper quadrilateral region. Similarly, the lower rough triangular part is divided into 2 parts by means of a vertical or longitudinal ridge. So there is a lateral part and there is a medial part. Now let us see the upper quadrilateral part that is divided by an oblique ridge into an upper lateral part which gives origin to the semimembranosus muscle. The lower medial part gives origin to the biceps femoris and semitendinosus muscles. In this picture, you can see the origin of the biceps femoris long head and the semitendinosus muscles from the lower medial part. And the semimembranosus muscle is taking origin from the upper lateral part. Coming to the lower triangular part, which is divided by a vertical ridge into a lateral part and a medial part. The lateral part gives origin to the ischial part of the adductor magnus muscle. That means there is an adductor part of the adductor magnus muscle which you must have studied during your dissection of the medial compartment of thigh. And there is the medial part. This medial part is subcutaneous part. This is the part on which one sits, and it is covered by fibrous tissue, and a overlying bursa will be there in relation with this part, which is produced because of the pressure on sitting. And in this picture you can see the adductor magnus muscle, the ischial part of it coming from the lateral part of the lower triangular region of the ischial tuberosity. And above the tuberosity will be the origin of the gemellus inferior muscle. You can see the gemellus inferior muscle. And then the lateral border of the ischial tuberosity gives attachment to the quadratus femoris muscle. This is the quadratus femoris muscle. Then the medial border of the tuberosity gives attachment to the sacrotuberous ligament. So above the tuberosity will be the attachment of the gemellus inferior. The lateral border of tuberosity gives attachment, lateral border, and extending on to lateral surface also attachment to quadratus femoris muscle. The medial border of tuberosity gives attachment to the sacrotuberous ligament. In this picture you are seeing both the hip bones, and then this is the ilium, this is the pubis, and this is the ischium, body of the ischium. With that there will be the ramus will be there, and this is the gluteal surface and tuberosity with its medial and lateral borders. Then this is the internal surface of it. We are seeing the pelvic surface of the hip bone, and this will be the border, medial border of it, and this will become the surface facing towards the pelvis and perineum. Because in the next slides I am going to discuss about the perineal structures in relation with this part. So this is the surface, this is the medial border. Then what about the medial surface of tuberosity? Now you know what is the medial surface. In the previous picture you have seen. So that will be there. It will be related to the obturator internus muscle. This is the obturator muscle, internus muscle, and in relation with that there is the fascia covering it. So that is the obturator fascia. So this obturator fascia, this obturator internus, and the ischial tuberosity, they are forming the lateral boundary for what is known as the ischio-rectal fossa, between the ischium and rectum. So it is forming the boundary for the ischio-rectal fossa, and there is what is known as pudendal canal is seen for the passage of the pudendal nerve and vessels that supplies the perineum. So it is also forming boundary for the pudendal canal. Because it has got clinical importance, you should know what is pudendal canal and then its relation with the ischial tuberosity. And about the pudendal canal you will learn during the dissection of the perineum. Now coming to the clinical importance of ischial tuberosity, and all of you now convinced that it bears the weight of the body in a seated position, and it is the potential site for the attachment of several muscles and the attachment of the ligament, sacrotuberous ligament we have seen. So what is ischial tuberosity pain? There is a bursa in relation with that. So if the bursa is inflamed because of prolonged sitting or because of wide range of movements, especially in athletes, the ischial tuberosity pain can be felt. So the soccer players, the cyclists, baseball players, the figure skaters, the cheerleaders, and any type of jumpers or runners are prone for pain of the ischial tuberosity. The other clinical importance of it, the pudendal nerve block by perineal approach. The ischial tuberosity is the landmark for pudendal block by perineal approach. So that's why the anesthetists and the surgeons who are performing surgeries in the perineal area, including the obstetricians, should know about the ischial tuberosity and its relation with the pudendal canal that contains the pudendal nerve vessels. So let us see that pudendal nerve, a little part of it. So it is a sensory nerve that supplies it is conveying the sensations from the perineal area, the external genitalia, the urethra and anus. It's a motor to the external anal sphincter and the sphincter muscles of the bladder. So the anal sphincters, the external part, and the sphincter muscles of bladder are innervated by the pudendal nerve, and it receives the sensations from the perineum, external genitalia, urethra and anus. The pudendal nerve block. So ischial tuberosity is the landmark for perineal approach to the pudendal nerve. And there is another approach for the pudendal nerve block, that is called transvaginal approach, that is through the vagina. So wherein the palpable landmark will be the ischial spine. So when an anesthetic fluid is injected into the pudendal canal for producing local anesthesia for the perianal surgeries, perianal abscess, the hemorrhoids, and in the case of obstetric practice, the pudendal nerve block is given to relieve the pain during forceps delivery of the baby. It's also used for anorectal surgeries and urological procedures to block the pain sensations in the area of the perineum. So pudendal nerve block by perineal approach, what they will do is the ischial tuberosity will be palpated subcutaneously, and you know where it has to be palpated and what is the distance from the midline and what should be the position, 5 centimeters from the midline, and then the hip should be flexed. That's what you have learned. Then the needle is passed along the medial margin of the ischial tuberosity for about 4 to 5.5 centimeters deep to enter the pudendal canal. So to give this pudendal nerve block, one should know about the ischial tuberosity and the medial surface relations to the obturator membrane, then the covering the obturator muscle and the pudendal canal which contains the pudendal nerve vessels. So now we have understood about the ischial tuberosity, the muscles attached and its clinical importance.